mydriasis? Paralysis of the ciliary muscle and loss of accommodation and pupillary dilatation. That is mydriasis. It is used to perform retinoscopy. Because in the retinoscopy, what is retinoscopy? Retinoscopy in the procedure use the person's individual's refractive status is estimated when the ciliary muscle is at rest. That means accommodation is at rest. To give the to neutralize that accommodation, we'll give this cycloplegic drugs, and then we'll perform the retinoscopy. These mydriatics cause pupillary dilatation. Mydriatics, it may these drugs include some drugs cause both mydriasis and cycloplegic action, and some drugs have only mydriatic action. It is used to perform in the cataract surgery. While performing cataract surgery, the pupil should be fully dilated to facilitate the extraction of the cataract. And while doing fundus examination, and for doing direct and indirect fundus examination, in the direct and indirect ophthalmoscopy, that means examination of the fundus and retina, and for any intraocular examination, there should be full dilatation of the pupil. And for performing any surgeries, like any surgeries means any for performing any lasers on the retina, we need a fully dilated pupil. The most potent anti-cycloplegic drug is atropine. It is available in the form of 1% drops or ointment. It's a strong mydriatic and cycloplegic drug. It is used to dilate in case of children of less than 5 years, below 5 years of age group, because in children they will have strong ciliary body muscle tone. So we use only atropine. Only atropine is potent to paralyze the ciliary muscle in case of children. It should be instilled 2 times a day for 3 days continuously. Then only we'll get the dilatation in case of newborn children and up to 5 years age group children. The maximum peak of action will be 2 to 3 days after starting of the drug. Duration of it will last, the duration of atropine action will last about 10 to 20 days. It is indicated in the children below 5 years and to break the synechia. That means where we get synechia? Anybody? What is synechia? Nobody? What is synechia? In case of any iridocyclitis, we'll get synechia, chronic iridocyclitis. And what are the other indications? In case of any corneal ulcers also, to give rest to the ciliary muscle, to relieve the ciliary body tone. Then we'll prescribe atropine in the form of 1% eye drops. The other one is hometropine. It is used both in cycloplegic and mydriatic action. This is also having both actions. It is used in the age group of 5 to 10 years age. Dosage is 1 drop every 10 minutes for 6 times. Then we'll get full dilatation of the pupil and cycloplegia. The peak action is 60 to 90 minutes. That means 1 to 1.5 hours. Duration of action is 3 days. Indication is, this is indicated in children below 10 years, 5 to 10 years. Sorry, 5 to 10 years age group. Below 5 years, atropine should be used. And the other one is cyclopentalate. This is only short-acting cycloplegic. It is also available in 1% eye drops, whereas hometropine is available in the form of 0.5% drops. This is also indicated in age group of 8 to 20 years of age group. Doses 1 drop every 15 minutes for 3 times. Peak action is 1 to 2 hours. And duration of action is 1.5 days. 16 to 18 hours. And the other one is tropicamide. This will cause only mydriasis, because in adults there will not be any that much of ciliary muscle. Ciliary body tone. So tropicamide, we can give tropicamide as a mydriatic to perform this fundoscopy. Uh, any fundus examination, retinoscopy like that, or any this is available as 0.5% to 1% eye drops, 5 to 1% drops. It will cause only mydriasis. There will not be any cycloplegia. Dosage is 1 drop every 15 minutes, 3 to 4 times, so that the pupil will be well dilated after instillation of drug. Peak effect will last up to 20 to 40 minutes. Duration of action will be up to 6 hours. So after instillation of this tropicamide drug, patient is asked to do not drive for 6 hours after having that retinoscopy or something like that. It is used only for dilatation of the pupil. The other one is phenylephrine. It is also available as 5 to 10% drops, used only as a mydriatic or in combination with tropicamide. Used in elderly and small people. Dosage is 1 drop every 15 minutes, 3 to 4 times. Peak action is 30 to 40 minutes. Duration of action is 4 to 6 hours, same like cycloventilate. This should be used with care in adults with shallow anterior chamber, because in adult people with shallow anterior chamber, that means only small eyeballs. Some people will have small eyeballs, and before giving these drops, you should see the anterior segment, whether the patient is having any shallow anterior chamber, because suppose a mydriatic drug is used in these patients, there will be every chance of getting acute attack of angle closure glaucoma due to closure of the angles. After dilatation of the pupil, there will be clogging of the trabecular meshwork with this iris tissue, and there will be precipitation of the acute angle closure glaucoma. So it should be used cautiously. It precipitates attack of narrow angle glaucoma in those people who are prone to get uh, narrow angle glaucoma. That means in hyperopic patients. Hyperopia means in hypermetropic patients and with patients with shallow antechamber, it should be used cautiously, because it may precipitate the acute attack of the glaucoma. It should be then, suppose the patient gets acute attack of glaucoma, it should be treated with miotic. That means pilocarpine 2% eye drops.